Good morning. Speakers coming up to you, we got something to give y'all. Ain't nobody giving us a check. We talking from our heart. We talking from our soul because we want you to get this information.
Prosper and be in good health. Amen. Say that with me. Prosper and be in good health. I want to thank my friend and brother, Don Doty, who envisioned this conference and many others. He has called on Mount Calvary and the use of this facility over the years, and Mount Calvary remains available to provide the facility and the use for the education of our people. Amen.
So in terms of diabetes, in terms of high blood pressure, in terms of cancer, most of these things that we have are a direct relation to what we eat and how we live. We lose 1 million people a year because of the way we eat, the way that we smoke, and the way that we live. In other words, the activities that we do or don't do. That's the problem. And if you have any of those things, the first thing that you should do is begin to eat more food that comes out of the ground, less food that comes out of a box. And if we don't teach that you can't have a healthy spirit in an unhealthy body, then we missed the boat.
I want to say today, because of Don Doty, we didn't come here today to go through a paralysis of analysis. We didn't come here today to talk again about how bad things are. We know that already. We came here today to get to therefore. And we're going to do that back through these faith-based initiatives. If we can get together like this today on this level, we need to get back together like this, like we did back in the day when we came together and we learned how to build up our communities.
I'm not an I person. I'm a we person. And the people that are coming up to talk to you, they're here to give you mentoring, to give you resources, to give you advice. And I hope that everybody here can take that advice and break down any barrier. My mother would have been proud to see that over 3,000 students, 3,000 individuals that were on welfare, that were in prison, depending on the government subsidy. It makes me proud to see them in their uniforms. I'd like for every student at CET to please stand and to everybody give them a hand. Where's the hard hats? Show me the hard hats. Look at them. They're going to build Chicago, because building maintenance and construction is an area that even if you got a felony, you got a record, you can still get work. Don't be stigmatized because you have a felony record. We can get past that. But the basic thing is give you guys a skill that you ain't got to look back and depend on nobody else. So I'm really touched to see the students that are here today. I'm proud to see this generation of students trying to make a change in their life.
So you need to know that in order to get these checks, you got to go to work, okay? So we're going to expose you to these companies, but part of what we do is we try to get you a job and wraparound services to that extent as well, so that not only do you get a house, but you have some resources to keep that house and move on. See, it's not about the sense of entitlement to the point where you get so strung out on it that that's the only way you live. We give you an opportunity to get that, then move on. You feel me? All right, so we're not the entitlement people. We just put you in a role where you can take advantage of some opportunities and then move on. That's all I want you to do, is move on after we help you, all right?
You have to find out what works for you, but you got to get a God source. You have to get a higher power. You have to, and not only that, it starts with application. You have to apply. And once you apply, it will be a better you. And I just want you to know today that no matter what you've been through, that you are all overcomers.
It's an honor to be able to see you now going through this program. It's an honor to know that your life has changed, and every opportunity that you want in life, you and everybody in this room can make it. All of those that inspire to complete this program, first things first, complete the program. Find a mentor, Find someone that you respect and look up to. Find ways to get connected to the people that are going your way and show others respect. Find a way to get the information that you need. Find a way to be as honest as you possibly can, operate with integrity. And I can tell you that you can go from one business to another as you please.
For all my building maintenance guys, hoorah.
It do bring tears to your eyes, especially when you see so many trying to make changes with their lives, to stay motivated and positive. The road to success is stressful and hard. I'm here to tell you that. Real talk, it is. But you got to stay focused.
Let me start by thanking Don Doty. I have never met a more passionate hepatitis advocate in my life. We've got about 4 million people in the United States that have hepatitis C. We estimate there's over 1 million people living with HIV in the United States. It has hit the African American community in a disproportionately hard way. It's really affected this community. Hepatitis C, we estimate that there are about 100,000 people in the Chicago area living with hepatitis C. So we do a number of studies and research kind of things in our area, and I think it's alarming that one of the studies that we did that showed a significant amount of people infected with hepatitis C, but more alarming, about 60% of them didn't know they had it. And this is what we've really got to work on.
Can you imagine? That means that it's possible that there are people under the sound of my voice right now that have hepatitis C and are not aware of their status. And that's why testing is so important. And at Vertex, we're working to work with community organizations to expand testing efforts so people can be aware of their status. Currently now with new treatment options available, hepatitis C, it is curable, so it doesn't have to be a death sentence.
Now that we're talking a little bit about how to do these things, let me show you the ways and means that you can take what you've learned and really put the ball in play, and how we're going to reach out and help everyone in the community and do that. And certainly, the way to do things and the different ways that we can reach people in all those different communities and the different diversities, we can reach people where they're going to live, work, perhaps play, and if we do it in the faith-based communities, where they pray. Let's make sure we show the ways and means how we're going to find ways to get people aware of all the causes that can affect health. First of all, there's public enemy number one in healthcare. Public enemy one is childhood obesity. First and foremost, the causes of obesity come from many different ways and many different means, but what obesity can do to a child and what it can do to families is effect upon effect upon effect upon effect. We're going to stop public enemy number one right here, right now.